Good morning, I'm on my way to work. I have little Ollie with me in this little dog crate here. He's coming in to be desexed today. I don't usually pick up my patients on my way to work, but Ollie is owned by some very dear friends of mine, so I am more than happy to take him into work today. Okay, so what we're going to do today is I'm going to follow his trip through the clinic today. So from start to finish, he's going to have a pre-anaesthetic blood test before his procedure to make sure that his liver and kidneys are fine. He's also going to have his deciduous canine tooth removed. So he has a retained deciduous canine that I'll be extracting. And he had the luck of being born with hind limb Dewclaws. So I will be amputating his hind limb Dewclaws as well. So little Ollie is having a very big day in the clinic with me today.
Ollie, good boy. This way, my way. Good boy. Ollie, good job. Hello. Oh, hi, Emma. Hi. You're a bit nice. You can turn your mouth. Good boy, little man. Actually, not even. I'll just clip that. Good boy. Good boy. Hi. He's so great. I'll clip it and then I'll put the big note on and then I'll get some peanut butter for him because he loves peanut butter and he'll have a little teeny lick off the spoon. Good boy. Just some lignocaine to numb it up for you, little man. Good boy. Friends? Want my friends? No. Say hi. And what if I go for you? Do you reckon you can? Maybe. Good boy. You want it? Oh, good man. Just might move his hands slightly that way. Yeah, beautiful. Good boy. Yeah, that's right. Good boy. Take the little hands down. Good boy. Yummy peanut butter. A little bit more, my friend. Whoop. So brave. Good boy. You're the best, Ollie.
Most fear-free blood I think I've ever taken.
Oh yeah. Good boy. And because he totally loves peanut butter, and I've been doing stuff out the back with him on the table, so it means he's less stressed out here too.
Yeah.
So
That's awesome.
Alright, these are Ollie's blood results and we've got plenty of green, which is what we want. So up here, this tells us the glucose, tells us his blood sugar is normal, so he's not diabetic. Urea, creatinine and BUN is all about kidney function, which is normal. Total protein, albumin and globulins are normal as well, and ALT, ALP about liver is fine. Electrolytes are normal, red and white cell counts are normal too. There's a couple of little abnormalities here on his platelets, so what I will do is I'll just do a blood smear and make sure that his platelet count is okay. To prepare the blood smear, I put a single drop of blood on a microscope slide and then I use a second slide to smear the blood across the slide.
nailed it. Alright, I could give you a check over, don't I, handsome boy? Make sure you're all okay. Good boy.
That's the sound of someone's morning meeting with their boss. Unfortunately, they never presented their sales figures. Unfortunately, they never got to show the new company brochure.
So, like Charlie would hoover that down. He's so gentle. Can I check your bum colour, darling? Good boy. It's got just one deciduous canine. Good boy. We'll sort that out today for you. Are you feeling your tummy? Check that there's no hernia. Good boy. Check you got your testicles. Yep. That's behind you. Pause 1, 2, You don't like bony attachments, do you? Can you break for a needle? What do you think? A little bit worried. Oh, what's Auntie Belinda doing? Boy. Gotta find your skin under all this hair. Oh, you're just the bravest. Didn't even notice that either. Good boy. Good boy, Ollie. Hi, buddy. Just the bravest boy.
That was cold, wasn't it? It was cold. Is this Ligno?
Yeah, I just screwed
I was
it down.
nice to read.
I was like, I screwed
I don't know
it
how
down.
Medicam is going to work on the skin. Give it a red hot go.
Yeah, I thought the outfit became labelled before.
I did.
Yeah, so I can't see any.
Just a bit more.
So which side, how do you know like if you are
Oh,
like...
so when you go down the trachea, you'll
Yeah.
feel the tracheal rings. So go dunk, 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 down the tracheal
Oh,
rings
okay.
here.
Yeah.
That felt more like mush.
Oh, okay.
Hence I was like,
Yeah.
ugh.
Yeah, okay.
I'm like, oh, I don't think I'm in the right spot. Always when you're filming. Slight, too short. No, I reckon it was probably in before too. It's weird. I feel his hips while he's upside down.
Yeah.
Ooh, waking up. Gosh. Good too. Lovely. 3, 2, lovely. All going well?
All in well, was this?
I know, it kept happening before and then I
Flushed it and then, yeah.
I think it's just because the fluid pump's down low and he's on a really low fluid rate.
Yeah, this goes. Gravity. You're like, I've just implemented Adriana the fluid stand.
I've got an extra arm.
Just cut this thing out.
Fine. Fine. At least she only gave you the fluid line. It could have been worse. She could have given you the litre fluid bag and the pump and then it really would have been
Wait.
So you have to make the Dewclaw clip as well, just check. Just something's going. Just stick around so. He's even got a foot pad. I know. So weird. This is gonna suck balls.
It's a fresh dream. Ooh, it's a fresh dream.
So it's hot in here.
The Bahamas, alright? We'll be getting out the lounge chairs.
It's like kicking back. Well, it's just so freezing cold this morning. I was like, I'm doing it warm this room up.
Because this one's working now, there's no brush.
Oh no, I stand on the other side. That's why I'm being more longer. I was like, what is going on? I can't do the castrate.
I love how you can't do it.
I was like, that is
Cutting down, right?
I know, I was like looking back to like, just trying to hold the testicles. This is hard. Why is it so hard? It's alright, I'm a professional. Yes, that's it. And he's got toy with balls.
Yeah.
So now that I'm on the right side of the table, it is time to make my incision. I'm performing a closed castrate. The first step is to make a pre-scrotal incision. I push the testicles forward towards the head and make my incision. With a closed castrate, the testicle stays within the tunica. I break down the surrounding connective tissue and ligate the blood vessels. With one testicle removed, it is time to repeat the process with the second testicle. And after both testicles are removed, it's time to close the incision in 2 layers. I close the subcutaneous layer using absorbable suture material and buried knots. The skin is then closed using skin sutures. It is now time to move on to the hind dewclaw amputation. Both of Ollie's hind dewclaws have bony attachments. I generally recommend their removal as the nails are much more likely to get caught, overgrown or torn. I make my incision around the toe. I control bleeding with pressure and hemostats as needed. The toe is removed using bone cutters. The incision is closed in 2 layers and the process is repeated on the other side. Throughout Ollie's surgery, his anaesthetic is monitored and recorded by my nurses Natalia and Adriana. We are constantly monitoring his heart rate, respiratory rate, blood pressure, SpO2, end-tidal CO2, his anaesthetic depth and his temperature. We are adjusting his anaesthetic gas and fluid requirements as needed and actively warming him up as required. Alright, it's time to move out of theatre and we're heading out to the dental area where we will be taking Ollie's dental x-rays and removing his tooth. So this is Ollie's retained deciduous canine here. It's pretty wobbly, so it should, touch wood, come out okay, but I'm just doing an x-ray first to make sure that it's all alright underneath the gum as well. It's time to place the x-ray plate in Ollie's mouth in preparation for his x-ray.
X-ray.
Hand over the x-ray plate to Nurse Natalia, who's going to develop the x-ray for me. That's where the x-ray plate goes through. And then that's like, get me out of here. You're like, duh. Poor Nat's thinking I'm telling her she knows how to do her job. This is where the x-ray is going to pop up. Right. So you can see that a lot of the root is actually already reabsorbing. So that's his x-ray, so let's take this tooth out, it's fine. Baby tooth. Alrighty, so we're just waking Ollie up from the anaesthetic. He's had his ET tube taken out. We're covering his eyes from light. It just helps to reduce his stimulation. And we're going to stay with him till he's nice and awake. He's got a little heater on him. And that's going to be looking after him. Hey Ollie. Hi handsome boy. Ollie. Ollie. Hi buddy. Hey. Oh, I should move the heater out of the way. You can't see you. Hey. How'd you go? Oh, you're such a good boy. You were so brave for surgery.
So Ollie's recovered really nicely from his anaesthetic. He's got a little heater in front of him to keep him nice and warm. And he's got some little booties on his back legs that you can see there. Good job showing us your booties, Ollie. That's just to help with some pressure from where the Dewclaws were removed and to stop him from bumping them. Good boy! So Ollie update, he recovered really nicely from the anaesthetic. He's been home and I have been checking in on him and he's doing really well. I'm very happy with his progress so far.